coronavirus is not the great equalizer. Although it can affect anyone, it hits the already vulnerable the most. In Brazil, new favelas are springing up overnight. Gilmar Goncalves Chavez is building a provisional shelter for his family. Before the crisis, he worked as a day laborer on construction sites. When work dried up, the downward spiral began.
The landlord didn't want to wait. He wanted his money, so he told us to move out. We heard that a lot of people in our situation were building shacks here, so we came here, cleared a spot, and are doing the same thing.
These improvised dwellings are crowded, and there are no toilets. Health authorities worry that the living conditions here could lead to a sharp rise in COVID-19 infections, threatening their livelihoods further, and thus completing the vicious cycle of poverty and illness. Welcome to DW's COVID-19 special. I'm Janelle Dumalaon. Thanks for joining us. Poor, in danger of getting sick, and then becoming even poorer. Too many people are finding themselves in this situation during the pandemic. But especially migrants are in a particular bind, with the governments of their host countries often taking insufficient responsibility for them. This next story takes us to the border between Nicaragua and Costa Rica.
A blue steel fence is all that separates Costa Rica from Nicaragua here. Elsewhere, concrete posts mark the border. Every morning, Nicaraguans cross the frontier to work on farms in Costa Rica. They are brought by truck to work illegally on fruit, rice and bean plantations. They earn less than half the official minimum wage. They've been doing it for decades, but now the border is closed because of the global health emergency. Gustavo from Nicaragua counts himself as one of the lucky ones. He's officially resident in Costa Rica. His wife is not, but officials tested them both for the coronavirus. The situation is worrying. I've been tested twice. Thank God both results were negative, but 2 of my colleagues got infected. So now we have to be tested again. Dozens of undocumented workers tested positive at this border pineapple farm. Only around a fifth are registered in the Costa Rican social security system. They earn less than $400 a month, working 12 hours a day. For many, it's the only way they can feed their families back home in Nicaragua, where conditions can be much worse. The Costa Rican foundation Areas for Peace is critical of the poor treatment of the Nicaraguan migrant workers. It says exploitation is widespread. Everybody knows about the smuggling networks. Everyone knows the woman who rents her garden hose to the migrants so they can wash their feet. They all know how much it costs. They all know about the taxi driver who will tell the migrants when the police have gone or when they're taking a lunch break. The coronavirus has just uncovered that reality. Migrants pay trafficking networks as much as $200 to smuggle them across the border. Ministers admit there's little they can do about the illegal employment. The legal framework does not allow fines to be imposed on business owners who employ undocumented Nicaraguan harvest workers. For this, we need a judicial decision on whether there is a legal infringement. Costa Rica does not publish the nationalities of coronavirus patients, but many blame the Nicaraguan workers for the growing number of COVID-19 cases. As well as raising tensions, the pandemic is highlighting the precarious conditions endured by migrants forced to cross Central America's borders to find work.
Professor Hayo Tsib of the Leibniz Institute for Prevention, Research and Epidemiology joins us now. Professor Tsib, you've written about how the risks and consequences of this pandemic are unevenly distributed. Socioeconomically speaking, we've seen in this report how especially vulnerable migrants are. And yet so many countries depend on migrant labor from around the world. What can be done to protect them?
So first of all, I think we have to basically respect their contribution to, economy, to society, and so forth. So that means help them to be able to cope with the epidemic, just as many countries try to do for the citizens living in the country anyways. So that means inform them, first of all, allow them, help them to, take those protective measures that are needed, improve working conditions such that distancing is possible, ensure that the living conditions are okay. Migrant workers often live under very precarious conditions in crowded accommodations. And these are the things that we can really do now to support those communities and make sure that they can really also, get the best out of the protective measures that are out there.
That coronavirus exacerbates inequality is something that's becoming clear. Is there any way to address this issue at a time where we still don't have a vaccine?
I think it does relate to what I was saying just before, that we now have to make sure that the conditions are there, that these groups, people with low socioeconomic resources and so forth, that they are able to really cope with the situation as best as possible. We have seen, for example, in the US that now the weekly support was cut, and immediately, the issues of unemployment come up, and this is particularly precarious for groups with low income and precarious jobs. They lose the little income they may have, and then they slip into real major economic but also social problems. And that also means health problems, because they will be having, a harder time to find care if they need it. They may have less access to the testing facilities. And all this is really something that needs to be taken care of now. And once a vaccine comes, another big issue is to make sure that it reaches especially groups under, major or higher risks than other groups. That will also be a big challenge.
So as you say, poverty leads to health problems, leads to more poverty. What does worsening inequality mean for the ability of the world's health systems to cope with this crisis?
Unfortunately, often more socioeconomic groups with low resources, they also suffer more from, let's say, chronic conditions. And those chronic conditions are exactly now those that make survival, or let's say the cause of the COVID disease, more severe. So we may have this situation that people with low socioeconomic status actually will be suffering more from COVID, and they are also at risk in the work conditions. So these are the things that the health systems will definitely see, and as more cases occur, and there will be more severe cases among people with low opportunities to protect themselves and who may have already pre-existing conditions. We'll see more really severe sick people getting into the hospitals that need to be taken care of, and not all systems will be able to cope with this.
Now, this isn't the world's first pandemic. Some experts say it won't be the last. So what lessons can we derive from today that would help shield those in situations most precarious from the worst effects of the pandemic?
We do see this so often in diseases, be it chronic or infectious diseases coming up, that we have social differences in the disease risk and in the disease course. So this is nothing new, and we just need to be acting more swiftly. And in the beginning already, be aware and realize that this is what is going to come, that we will have groups that are particularly affected by such a pandemic, and we need to start having structures that really allow swift and action that really brings those issues that are there out in the open immediately at the beginning of such pandemics, so that we can care for people much better, that we have the ability to look at these working conditions, change, for example, the working and living conditions of migrants immediately. And that shouldn't be actually a task for pandemics only, but in general. But it's hard to get the politicians doing this. We have been trying here in Germany. It is a slow process, but it needs to be done, and it needs to be done before the next wave of this epidemic or even future epidemics.
Time to act. Thank you very much, Professor Hayut Zib of the Leibniz Institute for Prevention Research and Epidemiology. Thanks for your analysis.
Thank you.
Now you get to ask the questions. Here's our science correspondent, Derek Williams.
I've heard researchers talk about trying to mute the immune response, but also saying that a younger, stronger immune system is more successful in fighting off COVID-19. Isn't that a contradiction?
To understand the apparent contradiction here, you have to understand that there are different stages of COVID-19 that patients can go through. The first is usually an initial infection in the upper respiratory tract, and that's usually where it stays with most people. That's where having a strong, fast-acting immune system is really great. It's able to keep the disease in check and eventually wipe it out. In some cases, it keeps it so effectively in check that you might not even notice that you had it. But in more severe forms of the disease, if the virus eventually makes it to the lungs or to other organs, it can kick in a severe immune response. And when that happens, the immune system can start attacking not just diseased tissue, but healthy tissue as well. That's when doctors have to step in and try to mute the immune response with drugs, because if it spirals out of control, it can kill you. But striking a balance between letting the immune system do its job and reining it in if it spins out of control is pretty tricky.
Now, there's nothing like a glass of lemonade on a hot day. In London, 2 enterprising 6-year-olds are selling cups of the juice to help with Yemen's humanitarian crisis. In just 6 weeks, the boys have raised more than $50,000. Yemen is reeling from the impact of a devastating war and the rapid spread of coronavirus. It's all from their own recipe, but the boys are keeping that a secret for now.